Today we'll talk about from JB Sharma. Okay, gynecological topic: vaginal infection. The infection and inflammation of vagina is called vaginitis. There will be vulvovaginitis. It can be bacterial vaginosis. It can be trichomonas vaginitis, candidal vaginitis, chlamydia infection vaginitis, atrophic vaginitis, non-specific vaginitis, toxic shock syndrome. Of any first we'll talk about vulvovaginitis, that inflammation of vulva and vagina. Vulvovaginitis is very common, especially in children, and due to thin vaginal epithelium as the result of lack of estrogen in children. There is because of lack of estrogen, there will the vaginal epithelium is thin, so that leads to more chances of infection in children. So then non-specific vulvovaginitis, the causes is non-specific vulvovaginitis, foreign body in the vagina, like children have the habit of putting the things in the vagina. Then worm infestation like hair thread worm, intravenous vermicularis, causing pruritus, scratching and infection. The specific infectious agents like candida albicans or gonococcus infection may cause infection, especially in presence of sexual abuse. Remember this, these are the causes of vulvovaginitis in children. The non-specific vulvovaginitis, if the children have the habit that they will putting the things in the vagina, like foreign body in the vagina, and worm infection like thread worm, intravenous vermicularis, causing pruritus and scratching and infections. Specific infections agents like candida albicans or gonococcus may cause infections, especially in presence of sexual abuse. If the child has a sexual abuse, there is chances of infection legend like candida albicans or gonococcus may cause infection, especially in presence of sexual abuse. Remember this thing. Then rarely there will be chances of tuberculosis can be seen in Asian and African countries. Then symptoms. What are the symptoms in vulvovaginitis? The main symptom is intense pruritus, itching on vulva and vaginal discharge. There may be associated with dysuria. Okay, there is a redness. There is redness and swelling of vulva, labia majora and minora. The main symptom is intense pruritus on the vulva and vaginal discharge. Remember this thing: main intense itching on vulva and vaginal discharge. There may be associated with dysuria. Okay. Then what are the signs? There is redness and swelling of vulva, labia majora and minora, redness and swelling, and vagina. There is excessive offensive vaginal discharge. In small children, a foreign body should be suspected, in which vaginal examination with an oral or nasal spectrum is useful. Okay. Then what are the investigation? In the vaginal discharge is taken with a cotton swab or sterile pipette or platinum loop. One part is sent for culture, one part is examined direct examination for gram stain. Stool examination is done to rule out women infestation for gram stain. Examination under anesthesia is vaginoscopy is needed to exclude foreign body or tumor or sarcoma botrytis in a case of recurrent infection. Especially in young girl or children, you should go for a vaginoscopy to see for any foreign body. Okay. Then treatment depends on the cause. In most of the cases, the cause is not known. Simple perineal hygiene is also maintained. Usually treat most cases. Ethinyl estradiol vaginal cream can be used for 2 to 3 weeks to improve the local vaginal defense. So ethinyl estradiol vaginal cream. Remember this thing? Ethinyl estradiol vaginal cream. Okay. Then when the specific organism is detected, the therapy should be directed to cure the condition. Like you can give a single 1 gram azithromycin oral tablets for chlamydia infection, or single oral tablet for levofloxacin 250 mg, or ofloxacin 400 mg, or ciprofloxacin 500 mg for gonorrhea infection. Remember, initial treatment is the perineal hygiene is the simply you can use the treat most of the cases. Then second thing is ethinyl estradiol. Remember this thing: ethinyl estradiol vaginal cream can be used for 2 or 3 weeks to improve. Remember this thing: 2 ethinyl estradiol for 2 to 3 weeks. For the treatment, the most of the cases the causes is not known. You go for a simple Perennial hycin usually treat the most of the cases. Ethinyl estradiol for 2 to 3 weeks to improve the local vaginal defense. And when the culture report is coming, in that according to that, you can give 1 gram azithromycin oral tablet. For chlamydia, if the culture report came as chlamydia, we can give for a 1 gram azithromycin single dose. Or if it came at gonorrhea, you can give a single oral tablet of levofloxacin 250 mg or ofloxacin 400 mg or ciprofloxacin 500 mg for gonorrhea. If it is come as trichomoniasis, you can give 2 grams secnidazole. And bacterial vaginosis, both trichomoniasis and bacterial vaginosis, secnidazole. Then albendazole 400 mg orally for worm infestation is given. Okay. Then bacterial vaginosis, it is the more symptoms. Synonyms is Haemophilus vaginitis, anaerobic vaginitis. Okay. Introduction, it is the most common cause of vaginal discharge in reproductive age group. This, remember this thing, the most common cause of vaginal discharge in reproductive age group is bacterial vaginosis. Bacterial vaginosis, previously called non-specific vaginitis. Gardnerella vaginitis, non-specific. It is also called as non-specific vaginitis. Gardnerella vaginitis is termed vaginosis rather than vaginitis. You should go for it. It is not an infection. It is a overgrowth. Vaginosis, termed vaginosis rather than vaginitis, as it due to alteration. This is alteration in the vaginal flora rather than due to any specific infections. Remember, the bacterial vaginosis is due to alteration in the bacterial vaginal flora, the vaginal flora, rather than due to any specific infection. So it is called a non-specific vaginitis. Gardnerella vaginitis, termed as vaginosis rather than vaginitis. There is a significant decrease in the number of Dodderel bacilli in the vagina with overgrowth of anaerobic and anaerobic bacteria like Gardnerella vaginalis, Prevotella, Mobilincus species. Anaerobic, all anaerobic bacteria overgrow. This is the alteration in the vaginal flora rather than due to any specific infections. That is the Dodderel bacilli. The Dodderel bacilli in the vagina, Dodderel bacilli in the vagina with overgrowth of aerobic and anaerobic bacteria like Gardnerella vaginalis, Prevotella, Mobilincus. Remember this. Then what is AMSEL criteria? AMSELs, although CDC does not consider it as a STD, there is increased risk of bacterial vaginosis with multiple sex partner. As for CDC, this is not considered as a STD, but there is increased risk of bacterial vaginosis with multiple. If you are using multiple sex partner, and that will increase the risk of bacterial vaginosis. But if you use the condom, then that will reduce the risk of risk with condom use. What is the criteria? AMSEL criteria: at least 3 of the following must be present to diagnose bacterial vaginosis. Okay. What are the criteria? First thing, first is homogeneous, white, milky, non-viscous, adherent vaginal discharge. Remember, this is homogeneous, white, milky, homogeneous, white, milky vaginal, homogeneous, white, milky, non-viscous. That should be non-viscous, not viscous. Non-viscous, adherent vaginal discharge. Remember the key word you should write in the examination. That is, the discharge should be homogeneous. There will be non-adherent, non-viscous. No, it's a non-viscous adherent vaginal discharge. Non-viscous adherent vaginal discharge. Non-viscous, whitey, milky, the vaginal discharge. We should describe. There is the homogeneous, white, milky, non-viscous vaginal adherent vaginal discharge. The vaginal pH more than 4.5. pH should be more than 4.5. The first point is the characteristic of vaginal discharge, that is it is homogeneous, thick, Homogeneous color is white, milky, non-viscous, adherent vaginal discharge. The vaginal pH should be more than equal to 4.5. Amine physiodor. What is amine physiodor? When 10% of potassium KOH solution is added to vaginal secretion due to release of volatile amine from the anaerobic metabolism, commonly called as the whip or amine test. The amine order, the PC order, when 10% of KOH solutions is added to vaginal secretion. Amine PC order when. How you will examine this amine PC order? When you add 10% of potassium hydroxide solution to vaginal secretion, you add 10% of KOH to vaginal secretion due to release of volatile amines from the anaerobic metabolism. What happened when you add? What happened when the 10% of potassium hydroxide solution is added to the vaginal secretion? Because of release of volatile amines from the anaerobic metabolism, because this vaginal secretion is completely alteration in the bacterial vaginal flora by anaerobic bacteria. This anaerobic bacteria, they metabolize this release the volatile amines by combine with the KOH solution, commonly called as whipped or amine test. The patient may also complain of fizzy odor after intercourse. Patient may complain fizzy odor after intercourse. Okay. Then patient may complain PCOD after intercourse. Because why they after intercourse, why they complaining of PCOD? Because you know that semen, that menstruation due to alkaline nature of the semen and blood causing the odor after intercourse and menstruation due to alkaline nature of the semen and blood causing this odor. Remember and understand the concept. What is whip test? Whenever anyone asks, you should explain this thing. Okay, first thing you should tell, after adding 10% of KOH solution to the vaginal secretion, there will be a reaction between the because of anaerobic metabolism by the anaerobic bacteria. They combine with the KOH solution, they release the volatile amines. This is called whip test or amine test. This PC order also the patient may complain after intercourse or after menstruation. Why? Because during intercourse, because of semen has alkaline nature, because semen has KOH, or that will lead to PC order because of histamine, because of blood also KOH, so that is causing this order. Presence of clue cells, another thing, the vaginal epithelium cell fuzzy or stippled border. Remember this key word you have to write in the examination. Presence of clue cells, that is vaginal epithelial cell with fuzzy or stippled border. Due to why there is fuzzy and stippled border? Due to adherence of bacteria making the edge of the cells obscure. The presence of clue cell, the vaginal epithelial cell with fuzzy or stippled border, due to the bacteria, they are adhering to the edges of the cells, they making the edge obscure. At least 20% of the epithelial cell you should get. This is the most important, remember this is the most important diagnostic test for bacterial vaginosis with 95% positive predictive value. Remember this, positive predictive value is 95%. If you get presence of clue cell, that is the clue for this bacterial vaginosis, that is 90%, 95% positive predictive value ki she has bacterial vaginosis. Remember, bacterial vaginosis 95%. Then last, the four criteria, that is, one is the homogeneous, milky, whitey, non-viscous, adherent vaginal discharge. Second is vaginal pH is more than 4.5. Third was the whip test or amine whip test or amine test, that is when amine or feces odor is coming when the 10% potassium KOH is added to the vaginal secretion. Because of anaerobic bacteria in the vaginal secretion, they metabolize from their metabolize that combined KOH solution that leads to production of the feces or amine odor. Because amine odor. Then patient also complaining after menstruation or after any intercourse because of the menstrual has blood, the blood has KOH, alkali nature of the blood, that will lead to feces odor, amine odor. Because semen has also alkali, so that's also lead to feces or amine odor. Presence of crucial is the true positive predictive below 95%. Homogeneous, whitey, milky, non-viscous, adherent discharge, vaginal pH, crucials and amine test. Crucial is the vaginal epithelium cells is stippled with vaginal epithelial cells have stippled bladder, fuzzy bladder due to adherence of the bacteria on the surrounding edges of the cells, making it obscure. At least 20% of the epithelial cell is the most important diagnostic test for bacterial vaginosis, with 95% positive predictable. Increased number of Gardnerella vaginalis and other microorganisms. The increased number of Gardnerella vaginalis, other microorganisms with reduced number of lactobacillus and leukocyte. At least 3 of the following has to be there for AMSEL criteria to satisfy: homogeneous, white, milky, non-viscous, vaginal pH more than 4.5, IPS ramentis, 2 cells, or increased number of Gardnerella vaginalis and other Pebatella and Mobelinka species, and reduced number of leukocytes and lactobacillus. Remember this thing. There is minimal vulval irritation or pruritus. Remember, minimal, this bacterial vaginosis, there will be minimal vulval pruritus or irritation. Remember, you should always exclude if the patient has vulval pruritus and irritation, then you should rule out bacterial vaginosis because there is less chances. The diagnosis is based on weight smear cultures. The smear reveals a clean background with few inflammatory cells and other organisms, but scanty lactobacilli along with clue cells. Very, very important. The scanty lactobacilli and clue cell is diagnostic of free floating clumps of Gardnerella seen. Gram stain vaginal smear is examined under microstain. Gram stain vaginal smear is examined under microscope for bacterial staining. And morphology. What are the morphology? What are the bacterial staining? The gram stain vaginal smear is examined. Gram stain vaginal smear is examined under microscope for bacterial staining. And morphology, that is called Nugent score. Nugent score. It is mainly used for research study. Test is in clinical practice. Grade 1 is normal. Grade 2 is intermediate. Grade 3 is bacterial vaginosis. Grade 1 normal lactobacillus type is predominant. The vaginal smear showing clue cell, the stipple epithelial cell with stipple bladder, fizzy bladder, because of the bacterial is adherent to the edges of the cells, that making the edge obscure. At least 20% of the epithelial cell, at least 20% of the epithelial cell has been started with this. Then grade 1 is normal lactobacillus hermaphroditic. Grade 2 is intermediate mixed flora with some lactobacillus is present, but Gardnerella and amoblication is present. Grade 3 is predominantly Gardnerella and amoblication hermaphroditic, but present lactobacillus either absent or few. It can cause PID, post-abortal PID, or post-operative cough infection after hysterectomy or abnormal cervical cytology. Though that bacterial vagin, it can cause PID, post-abortal PID, post-operative cough, celluloid infections after hysterectomy, abnormal cervical cytology. Okay. Then bacterial vaginosis and pregnancy. Bacterial vaginosis is associated with premature delivery, premature rupture of the membrane, preterm labor, neonitis, Postpartum endometritis. Bacterial vaginosis is associated with PPROM, preterm delivery, chorioamnionitis, postpartum endometritis. Treatment of CDC 2015 is usually recommended the following to bacterial vaginosis. Recommended regimen is metronidazole 2 gram single dose or metronidazole gel 0.75 gram single application daily for 5 days. If you apply gel, you can go for 5 days. You can single dose 2 gram single dose. Clindamycin cream 2% application single alternate regimen. Tinidazole 2 gram once daily for 2 days. Clindamycin vaginal phase 3 100 mg once daily at bedtime for 3 days. Clindamycin 300 mg twice daily for 7 days or 1 gram orally for daily for 5 days. If you are giving phase 3 for 3 days bedtime, then twice daily for 7 days. Cure rate is 80 to 90% can be achieved, but recurrence rate is 30% in 3 months. Remember, cure rate is 18 to 90%, but the recurrence is the cause. Recurrence is the only things that has to be headache. It is 3 months with 30%. Alternative like lactobacilli, yogurt, disinfectants have inconsistent role. Oral probiotic therapy with lactobacillus can cause lactobacillus to colonize vagina, preventing overgrowth of the organism. Then, what are the other causes of vaginal infections? That is trichomoniasis in vaginitis. Vaginal trichomoniasis is the most prevalent non-viral STD. There is not a viral cause. This is a protozoa. In the reported cases, it caused by motile protozoan parasite Trichomonas vaginalis, which is 9 to 7 micrometer with 4 anteroflagella and an axostyle at the other end. The organism exists only in trophozoites form and is anaerobe. It generates hydrogen to combine with oxygen to create an anaerobic condition. It generates hydrogen to combine with oxygen to create an anaerobic. It accompanies bacterial vaginosis up to 60, it accompanies the bacterial vaginosis 60% of women. What are the important things in bacterial vaginosis? It is the most prevalent non-viral STD in reproductive. It causes a motile protozoan parasite. The Trichomonas vaginalis is 9 to 7 mm with 4 anterior flagella but an axostyle at the other end. The organism exists only the trophozoite form is exist. It is an anaerobe. How this bacterial, how this protozoa make the environment anaerobe? It itself produces hydrogen that combine with oxygen that make the environment anaerobic. Usually it accompanies 60% of bacterial vaginosis patient. Then this is the 4 flagella anteriorly, single nucleus, cytostome, axostyle, vacuole with bacteria, rarely RBC, blepharoblast, master granules. Diagram to represent Trichomonas vaginalis. Vaginal smear showing Trichomonas vaginalis. Mode of infection. So it is mainly transmitted through the sexual contact because it is STD from male perineum, urethra, urinary tract. Usually a marker of high risk behavior. It is commonly associated with STD like gonorrhea. The incubation is 4 days to 4 weeks. The pathology: the organism found in vagina, urethra, para-urethral gland, Bartholin gland of women in up to 25% of women. May be asymptomatic in 10 to 50% of infected women. It infects squamous epithelium, remember, of vagina, causing vaginitis, increasing susceptible to other STD. The infection is more common after menstruation, after sexual activity or illness. The symptoms: profuse, offensive, thin, yellow, greeny. Remember this symptom: profuse. Green difference is non-viscous. Green for the yellow, offensive. Profuse, offensive, thin, yellow, green for the discharge. Profuse, offensive, thin yellow or green for the discharge. Remember, this vulval pruritus is very common. You should ask this history. You should ask for itching. Vulval pruritus. This is the important thing for Trichomonas vaginalis and Candida also. And there should be a dysuria, dyspareunia, vaginal spotting, vaginal pain. Some women may complain of lower abdominal discomfort. These are the symptoms: profuse, offensive, thin yellow or green for the discharge, Vulval pruritus is common. Dysuria, dyspareunia, vaginal spotting, vaginal pain. Some women complain lower abdomen pain. Vulva signs में vulva is erythematous, edematous, excoriated, thin green yellow for the offensive vaginal discharge. The pH of secretion usually more than 5. Vagina is inflamed, swollen, congested with strawberry spots due to subepithelial hemorrhage. Strawberry vagina is the strawberry cervix called pitis macularis. Culpitis macularis. Culpitis macularis is the presence of punctate hemorrhage. Colposcopy is cervix. Culpitis macularis in presence of punctate hemorrhage. Vesicles and papules on cervix is specific sign of trichomonas usually. There may be associated soreness of vulva and perineum. Is the sign that vulva may be erythematous, edematous, excoriation will be there, thin green yellow vaginal frothy offensive vaginal discharge, pH is more than 5, vagina is inflamed, swollen, edematous, congested, strawberry spots due to subepithelial hemorrhage, strawberry cervix or colpitis macularis is presence of punctate hemorrhagic spot, vesicle, papules on the cervix. Its specific sign of trichomonas vaginitis, that is the strawberry cervix colpitis macularis, is the presence of punctate hemorrhage, vesicle, papules. There may be a soreness of vulva. Perineum diagnosis is wet mount preparation, hanging door preparation. Nature drop of saline is added to drop of vaginal discharge on a glass set with a cover slip detecting motile trichomona. The sites could be examined within 20 minutes of cooling, make them less mobile.